Hello, this is Dr. Richmond C., Assistant Professor at the University of Ottawa. Here with me is Dr. Paul James, who is the principal author of an upcoming publication in the February edition of Gastrointestinal Endoscopy. Hello, Dr. James.
Hello.
Congratulations on your upcoming publication.
Thank you.
Could you please tell the audience a little bit about yourself?
Sure. I'm a gastroenterologist and therapeutic endoscopist at the Ottawa Hospital. I'm also a clinician investigator with the Ottawa Health Research Institute and assistant professor with the University of Ottawa.
What is the title of your study, and who are your collaborators?
The study title is Incremental Benefit of Preoperative Endoscopic Ultrasound for the Detection of Pancreatic Neuroendocrine Tumors, a meta-analysis. The co-authors include Apostas Solakis, Mei Zhang, Rashid Mohammed, Paul Bellatruti, Derek Roberts, and Steven Heidman. This is a collaboration between the University of Uppsala in Sweden, the University of Calgary, and the University of Ottawa. The author affiliations include the Department of Medical Sciences at the University of Uppsala, the Department of Surgery at the University of Calgary, the Department of Medicine at the University of Calgary, and the Department of Community Health Sciences, University of Calgary.
Why don't you tell us about your manuscript and the inspiration that led to this study?
So I performed a clinical and research fellowship in therapeutic endoscopy at the University of Calgary. And during this time, we had multiple clinical encounters where I found endoscopic ultrasound was able to detect a lesion missed on previous imaging, such as CT scan and MRI. Specifically, there were multiple occasions where patients with suspected pancreatic neuroendocrine tumors were found to have a tumor in their pancreas on endoscopic ultrasound that wasn't seen on previous modalities. I performed a literature research on the issue, and I found multiple case series and retrospective studies that consistently demonstrate a benefit of endoscopic ultrasound for the detection of these lesions. However, these studies differed in design, study size, and the estimate of benefit, and for this reason, I felt like a meta-analysis would be helpful.
Why don't you take us through some of the results and take-home messages from this study?
I think there are three take-home messages from this study. The first is endoscopic ultrasound has a high sensitivity for the detection of pancreatic neuroendocrine tumors. In our study, we found the sensitivity to be 96%. The second is that endoscopic ultrasound consistently identified pancreatic neuroendocrine tumors that were missed on previous modalities, including CT scan, MRI, and octreotide scan. We found that endoscopic ultrasound was able to identify a lesion in 1 in 4 cases where the lesion was not identified on previous modalities. Finally, this consistent finding was not changed by study setting, when the study was performed, either before or after the year 2000, whether the study was performed in Asia, Europe, or North America, or finally, the number of imaging modalities performed prior to endoscopic ultrasound.
Could you identify some of the limitations of this study?
Well, the included studies in the meta-analysis were all observational studies, and the majority of them were retrospective. Finally, most studies did not describe the type of CT scan used prior to endoscopic ultrasound. It could be that more modern, high-definition multi-detector CT scans will be better able to detect pancreatic neuroendocrine tumors, therefore reducing the potential benefit of endoscopic ultrasound.
Now that your study is complete, what are the future directions from here?
Given that pancreatic neuroendocrine tumors is an uncommon condition, large prospective randomized controlled studies are unlikely to be performed in this area. With this in mind, well-designed prospective databases investigating the benefit of multiple imaging modalities, including endoscopic ultrasound, for the detection, staging, diagnosis, and management of pancreatic neuroendocrine tumors would be very helpful going forward. This would be ideally performed in a multidisciplinary collaborative setting that includes gastroenterologists, medical oncologists, surgeons, and radiologists.
Thank you very much, Dr. James.
Thank you, and thank you to the American Society of Gastrointestinal Endoscopy and the editorial board of the Gastrointestinal Endoscopy Journal.